In this day and age, we all appreciate the importance of data and information, no more so than National Services Scotland. To find out how this data and information can be used to improve the lives of service users, I went along to National Services Scotland and spoke to Manira Ahmad, Head of Service for the local intelligence support team. So thank you for joining us, Manira. Can you tell us a bit more about the purpose of the Information Services Division?
So the purposes of the Information Services Division is allow access to information which is available not only locally but nationally, develop tools and techniques which allows the user to very easily look at data that suits their service area. And it also allows individuals to look forward, so not only looking at the past or what's happened and what we've done, what we're doing now, but actually look forward to what could potentially happen if services run in certain manners. We have done this for over 50 plus years, so you can imagine we have a wealth of data around the health arena, but only over the last few years have we really taken stock and understood the importance of social care. And actually to really support health and well-being, we need to marry both the health and social care data together. So as I say, the last couple of years has been a real new venture for us to be out within the health and social care arena. We've been using the expertise that we built up through analysts, information manager and plethora of other skill types that we have to deploy that locally. So understanding what the data has told us historically, understanding and using algorithms to look forward into the future if we continue deploying services at the rate we are, what that would do to the health service and the social care service, then using that operationally to see what does that really mean to the end user, the service user, that inevitably will benefit for the health and the well-being that's being served operationally.
So what do we mean by local intelligence?
So local intelligence is all about bringing data and information out locally to individuals that work in the front line. But rather than me going in and explain too much about it, what I'd like to do is show you a video that takes you through the journey of local intelligence and our reach.
We understand the challenges that are being faced every day by you in gaining insight into your local services and community. With increased joint working across health, local authorities, third sector and community planning partnerships, we know there is a need for better joined up data to support decisions that are right for your community. You can access data about acute care through our Discovery product. Analysis on social care data and costing information is available through the Source Toolkit. Work is well underway in enabling better access to GP data too, through Spire. We aim to provide a single access platform to these products to make it easier for you to get the information you need to answer your questions. We provide a network of locally based analysts and information management specialists who work closely with you to provide insight on local priorities. We link in with our colleagues nationally to ensure you can fully harness the information that is available. All of this information and support can really help you to improve your integrated service delivery to improve the health and well-being of your community.
So as you've seen in that video, our reach is expanding. So in 2015, we started working with the health and social care partnerships. And what we quickly realised was all the other plethora of organisations such as the third, the voluntary sector, the local authority that sat around that arena that were also delivering levels of care to the community and the service users. So very quickly, we started to work and bring in data and information from organisations that we hadn't touched before, which has now led us to the current day where actually we're increasing our reach into the primary care field, into GP practices, and aligning our data and information to the GP clusters, which officially launches 1st of April 2017.
So what are the different types of approaches we are taking with data and information?
So there's been a wide range of approaches that we've been taking with the data and information. From one place we've been linking data from different sources and actually being able to map from the birth to the death of an individual, the whole journey, how the individual touches health, social care, the voluntary sector, the private, the third sector. And that suddenly starts to paint a picture as to how information can then influence where we go from there. We've been able to open the eyes for some professionals on the front line to actually see the journey of the individual from the start to the end point. We're also bringing people along with us on the journey by co-creating what data should be telling us. So there's a piece around developing new platforms to support what's best for Scotland. So rather than doing little wee programmes of work and duplicating that effort across Scotland, what can we do to support and minimise that? And what we've done is we've developed a number of platforms to support the data and information that is out there. One of them is known as Source, which is the health and social care platform. We're also developing our Spire platform, which will be there to support the GP practices and more so the clusters and understanding the data available within that sector.
So how is local intelligence expanding across Scotland?
Local intelligence is at a really exciting time. So this year for us, we will be venturing into the GP clusters. Very, very new for us in the territory which we haven't been in since the last 17 years. But what's more exciting is that all the information that we've harnessed over health and social care, we're now going to be able to link that with primary care. So for us, that's going to make us understand the true journey of individuals. How can we really shift that balance of care? And how can we empower professionals from GPs to link workers, to practice managers, to care workers, social workers? How can we empower those individuals knowing what information is telling us, so each contact they're having with the service user is the one that is needed for that service user, is beneficial for that service user, and really supports the wider agenda of individuals living healthier, longer lives in a homely setting.
So finally, what is the vision of local intelligence for the future?
So for that, the world's our oyster, if I could say that. But for predominantly right now, for us, the focus is for Scotland. How can we help all the individuals the way they need the help under health and wellbeing? Now, I've touched on a few areas that we've done and now we're expanding into, but there's much more out there. There's much more out there that we're still to look into and understand. But the key piece that runs through all of this will be the information and the data that comes with it. So for us, it's now to understand where else do we need to be, so where else do we need to get data and information from? What other institutions and organisations which we haven't been collaborating with need to be part of that co-production? And the other piece for us is supporting communities understand the data we're producing. So data is only as good as what or how people read it and how it's used. So the big focus for us over the next few years will be to support communities and support professionals to be able to read and understand the data, and importantly, do something meaningful from it. So actually be able to make a decision or deploy a service that's the right service, but is supporting the health and well-being of those individuals within the community.
Manira, thank you for joining us. Well, that's all we have time for this month.